Hi, I'm Georgette Harrison, and I'm the Director of Clinical and Community Partnerships at the Child Guidance Center of Southern Connecticut. Today I'd like to talk to you about what you might be observing in your little ones as we face COVID-19 together and what you can do to support them. It would not be an exaggeration to say that our lives have changed significantly since the pandemic started, and that it would be natural to be having some difficulties adjusting. You might notice that your child seems to be having more emotional outbursts or tantrums than usual. He or she might seem more withdrawn, maybe not as playful as they usually are. Your child might cry at the drop of a hat, seemingly over small things. They might be clingy, afraid to be alone. Their sleep might be a little bit more interrupted, waking up more in the middle of the night, or resisting going down for bedtime. Or you might see that your child seems to be overly bright and happy, almost hyper, not wanting to talk at all about how their lives have changed. They might be eating more or less, maybe pickier than usual. And you might overhear them as they play with their toys, talking softly about how their toys are sick or maybe need a doctor. These are all natural reactions to a significant stressor or when their daily life has been upended the way it has been. Now, I encourage you to talk to your kids about what's going on in a developmentally appropriate manner. You could tell them that there is a virus, like a cold, that's going around, and that we're keeping each other healthy by staying home for a little bit. You can focus on safety, telling them that we're all working hard to keep nice and healthy. You can also focus on finding the helpers, like Mr. Rogers once said. You can tell them that there are people like doctors and nurses who are working really hard to take care of the people who have caught the virus. Equally important is allowing them the space to be able to share all the feelings that they might be having, like feeling scared or sad or angry. Share with them that it makes sense to feel that way, that sometimes you feel that way too, and that you are there to help them talk about it. Remember that what is shareable is bearable. Now, the goal is not to fix or do away with those feelings. The goal is to help your kids know that they're not alone with their feelings, that you will keep them safe, and that you will help them use their language to make their inner world known to you. When we feel like we're not alone with our feelings, those feelings become easier to manage. Now, don't be surprised if these conversations last 1 or 2 minutes, and then they jump off your lap and run off, or ask to read a book, or change the topic of conversation, only to come back at bedtime and ask you the same questions over again. This is not to say that your children forgot or that they don't want to talk about it. It's that little people process what is said to them in bits and pieces. And when they've heard enough, they walk away. And then when they're ready to talk about it again, they come back. We should respect their pace as much as we can. As much as we can, we should also try to keep to a routine. Predictability makes a child feel safe. Now, that's not to say that you should be trying to recreate a preschool environment in your home. Goodness knows you have enough to do already. Instead, focus on trying to create a rhythm to your day, paying close attention to your children's biological rhythms. Wake up at the same time, have meal times at the same time, try to have nap time and bedtime at the same time. Create a bedtime routine that happens around the same time each night. As much as you can, try to get some physical activity during your day as well. And when you can, do a video chat with a loved one or a friend so that you can reduce their sense of isolation. And as difficult as it may seem, please try to stay off the news. This is way more information than your child needs, and it increases everyone's anxiety. Now, along with this video, we're also publishing a document with links for articles and books and poems that you can use to start the conversation with your children. Please take some time to review it, and if you find it helpful, please feel free to share it with parents. Now, for most kids, this is just a momentary stressor, and they will bounce back. Kids are incredibly resilient. But if you notice that your child is really struggling, please reach out to a mental health practitioner in your area. If you call your insurance, they can provide you with names and numbers of mental health practitioners who are providing telehealth services. You can also call your local child guidance clinic. And if you live in Darien, New Canaan, Stamford, or Greenwich, you can call the Child Guidance Center at 203-324-6127. And if your child is in crisis, please don't forget that you can always call 211 and press option 1 to be connected to a crisis clinician. Now, if you're struggling, please remember that the best way to take care of your child is to take care of yourself. Call your insurance company and get names of adult mental health practitioners in your area. And if you're receiving your medical care through the community health centers, please ask your doctor to refer you to an adult mental health practitioner by calling 860-347-6971. Hang in there. And remember that while it may not seem like that right now, there will be an end to this, and we will all be able to go back to our daily routines and daily lives. Hang in there.